This is EN Radio. Nigeria's first Muslim radio.
Assalamu alaikum. Hello and welcome to the Health Advocacy Show, your go-to show for health issues and remedies. This is the show where you learn about things that may be wrong with your health, solutions to the problem. And today we're going to be talking about how you should treat your skin. You know, the do's and don'ts of how you should relate with your skin, what you should do and what you should not do. And I have with me in the house Dr. Hadiza Marliya Tijani Suleiman, a consultant of burns and plastic surgeon. Assalamu alaikum, ma'am.
Wa alaikum assalam wa rahmatullahi.
Now, it's good to have you in the house today.
I'm happy to be here.
Oh, great. Very much. Okay, so could you please tell us, as a bit of a background, the layout of the skin and why it's even important that we have an outer covering in the first place?
Yes, so we all know that the skin is a very important part of the body. It covers a large surface area over our bodies, and a lot of people actually don't know that the skin serves as a form of a barrier or protection from outside forces, from extremes of weather, ranging from, excessive heat, excessive cold. It protects, it provides that barrier against infection. Skin, once that barrier to this skin is breached in any form, in the form of maybe burn injuries or in the form of, trauma causing wounds, the human being, the human body is prone to many, problems. So that is why the skin is such an important part of the body. The skin has several layers. Notably, if you read textbooks, actually, you'll see that it has 5 main layers, and they're all protective in their own form. They all have their own functions, and they all contribute to the stability and the strength of the skin.
Okay, great. So basically, we understand that the skin is there to protect us from a lot of things, external mostly, and especially extreme weathers. That's basically what I got from you. So I came here with a number of myths in my head. We got acculturated with that we should do this to the skin, we shouldn't do this, we should do this, and all of that. So the first thing I know, growing up in a boarding house it was an all girls, and the first thing is we used to apply toothpaste. When you have acne or pimple or something, and then they say, "Oh, go and put toothpaste." So how does that sit with you, Dr. Hadiza?
Yes, actually, there are so many, over-the-counter products that have been used by so many people over, decades, centuries, actually, that, well, although you can say in some people you see some effects, they also have their own side effects. So I would advise anybody who receives any form of information from just anyone about using certain products on their face for certain skin conditions to actually not do that, because sometimes the person may actually be allergic to these products, or he or she may not know that these products contain certain chemicals that may be harsh to the skin and then can cause, scarring or hyperpigmentation, darkening of the skin, or even many other side effects. So, though yes, you might say that, oh yeah, maybe I used toothpaste, I used McLean's, I used Close-Up, I used certain products that were recommended to me by certain people and it cleared my acne or my pimples. It may not be the same for someone else. It may not be effective for that person, and it may cause allergies or even side effects because of the harsh nature of, that compound. These substances are not used conventionally for treating acne. They're much better products for treating acne or pimples.
Okay, really. So it's just basically about the makeup of the substance that might have been applied to the skin, right? Not necessarily that toothpaste may be bad for the skin.
Toothpaste, it contains it contains so many chemical substances. And conventionally, toothpaste is supposed to be used as toothpaste, you understand? There are other substances or other compounds that have been formulated specifically for skin. As I told you before, the skin is a very delicate structure. It needs to be protected adequately. So we don't just use any product for the skin. The products that are used for the skin are specially formulated in a way that the skin will be protected from certain chemicals or certain age may damage it in various ways. So I think we could leave certain substances for their own known specific benefits, and then use a recognized, medically proven, medically advised compounds that are used for treating certain ailments of the skin, rather than using what other people use just because they said it worked for them.
Okay, great. Really interesting. Okay, so another myth that I came across, although I of course I didn't try this because it was rather disgusting and really somehow, is the application of menstrual blood on the skin. I don't know how.
Wow. I've actually not come across that.
Exactly. Really. Really, okay, so I think a lot goes down in schools, amongst teenagers and all of that, because that was where I heard it from. And since then, I was like, I'm going to ask a medical practitioner or an expert or something. So I really don't know what the idea behind it is, because they felt it was effective.
Human beings are very funny people. Even though we have so many medically proven ways of managing certain conditions, we prefer to use alternative, things to manage our conditions. I think using menstrual blood is not really a good idea. Menstrual blood, it's already out of the body. It's prone to, being acted upon by bacteria, in the environment. And I think one would not want to apply, a substance that bacteria have already acted upon it, on your skin. When, as I said before, there's so many other things that you can use, for your acne. Actually, this is the first time I'm hearing about menstrual blood being used to manage pimples or acne.
Okay, right, amazing. Great. Now, so naturally, when I wake up, how should I treat my skin? What should I do to ensure that I'm not putting it in danger, or I'm not, just to make sure that I'm taking care of the skin?
Yes, well, the skin can be managed in many ways. You can manage it outwardly, you can manage it, inwardly. So, first of all, I think that we should start with ourselves. One of the best ways to take care of our skin is, making sure that we eat, the recommended diet, which is proven to make sure that you don't have, breakouts. You have a balanced meal made up of your nutrients, your carbohydrates, your proteins, your vitamins, and your minerals. And then take a lot of vegetables and fruits. That has been proven medically to make you have very healthy looking skin. Apart from that, one should also exercise. I know many of us don't exercise. Even I sometimes struggle with exercise, but exercise has also been proven to make sure that, you have healthy skin, both in and out. Then, of course, we must have heard that, it's good to take a lot of water. It's good to take at least, 3 to 4 liters of water a day. If you can, if you have a very large measuring a jug, or maybe like a water bottle, which measures about 4 liters of water, you can just keep that in your water bottle and make sure that you drink, from that, you pour it into your cup and make sure that you finish that bottle of water in a day. Sometimes in extremes of temperatures, for example, when it's very, very hot, you may actually need to take much more than that. And then other times when it's also very dry, you may need to take a lot of water. So those are just some of the, basic things that we can do, with our daily habit, in improving our skin. Apart from that, you can also make sure that, okay, in the morning when you wake up, you make sure that when you're going to have your bath, you wash your face with water. You use a gentle cleanser, or, a gentle face wash. that's not too harsh, won't strip your face of the essential oils, and that will remove the dirt, the makeup that has accumulated over the night. Although, of course, it's advised that before you go to sleep, you still wash your face, before you go to sleep. There's actually a routine for the face when you're going to sleep. So you wash your face with that natural face wash or cleanser. Then afterwards, you then go on to use a moisturizer. Commonly these days, we have moisturizers that actually have an SPF. An SPF is a sun protection factor contained in it. Now, these are sunscreens. These sunscreens, especially in our environment here in Nigeria, are important because they prevent, our skin from darkening. They help our skin from, from the harmful effects of the sun. The sun has been known to cause what is called medically photoaging. The sun can cause wrinkles and lines. So if you have this sunscreen included in your moisturizer, it will go a long way to help, keeping your skin looking healthy and also youthful. You may also have apply the sunscreen separately, but I think it's easier, especially these days where you have a lot of moisturizers that have sunscreens in them. And then,
Dr. Khadija, just to cut you short a little bit, is there a routine, is there a particular manner in which you wash your face, either in the morning or in the night? Because I know I'm usually told I'm not supposed to wash with a sponge. I'm supposed to have a separate towel for my face because I'm not supposed to use the same towel I use for my body for my face. So how true is that?
Yes, there are a lot of controversies regarding that, using a separate towel from your body towel. But yes, I think it's in order for you to use a separate, towel for your face, being that the face is such a delicate, part of the body, and it's something that you're exposed to the outside environment. Generally, if you're going to use a face wash, you just need just a little dot, like just a spot on your finger. You dab it over the face, over your cheeks, over your forehead, your chin, your nose, and then you just use gentle circular movements, with the palms, with the tips of your palms, to rub the cleanser into your skin gently. Just circular, gentle motions. You don't really need to use any sponge per se. Using your fingers, the tips, the pulps of your fingers is actually enough. You make sure that the face wash or the cleanser covers the entirety of your face to help dissolve that dirt and the oil, and then you now use water to wash it off. There are many other skincare routines that can be done to help exfoliate your skin. Exfoliation is supposed to be done ideally, let's say about some people advocate 2 times a week, but I think once a week is enough. And in those cases, you actually have special exfoliants that are, not too harsh, to the skin, that are applied. So you don't really need to use a sponge, every day, to wash your face. Just the tips of your fingers.
That's really interesting. Really interesting, because now I understand why I'm not supposed to use a sponge, because it's harsh, right? And then it could take away the essential oils from my face, like you mentioned. Really interesting. Okay, so this has been interesting so far, but I think we should go on a short break now, and then when we come back, we're going to continue.
All right.
For so long, Muslims have been seen as the butt of all jokes, the bad eggs, misfits, and never-do-wells. Now it's time to change the narrative. EN is changing that with EN Radio, giving new perspective to information. EN audiobooks that speak to your mind. EN Records, giving voice to the new generation of artists. EN TV, birthing a new vista to understanding prophetic traditions. E-Narrate, creating a new narrative.
And yes, we're talking about how you should treat your skin. I first started with a number of myths that I have heard or I've come across in the short years that I've lived. And Dr. Hadiza made us understand that you're not supposed to just apply any kind of chemical to your face. You're supposed to use the ones that have been medically proven, right? And then we talked about applying menstrual blood to the skin. That's not really advisable. So, yes, if you have any questions, if you have anything that you want to contribute, make sure to call in or send us a text or a voice note via WhatsApp at 08096405786. I'll take that again, 08096405786. Great. So, Dr. Hadiza, you told us about some of the things that you were supposed to do in relation to our skin, the skincare routine, application of a moisturizer that contains some kind of sunscreen, and also exfoliating. You said exfoliating once a week is good, although some people advocate for more times a week, right? Now, what are the things we're not supposed to do? What are we not supposed to? What do we do that we're not supposed to do?
Okay, so sorry. In addition to what we initially talked about before the break, there's one other thing that is recommended to do skincare routine of making sure you use your cleanser, your facial wash. Afterwards, it's advocated, that you apply a retinoid. Retinoids have been proven to be helpful to the skin in such a way that they help prevent photo age. They help prevent wrinkles, lines, and they have been found to have some anti-cancer effect, as well as a number of other benefits. So it's advised that one uses a retinoid before going to sleep. The reason why we say that the person should use the retinoid before going to sleep is that if you use it during the daytime, your skin may actually react because the sun has a way of reacting with that retinoid in the daytime. So if you apply it at night, you have less chance of your skin reacting in the form of blistering or in the form of, skin peeling.
But what's a retinoid, Dr. Hadiza?
It's one of the substances it's one of the compounds that it comes in a gel form or it comes in a cream form. It's actually a compound that you apply over the skin. It looks like a moisturizer sometimes, but it's not actually a moisturizer. It has a separate function, as I mentioned before. It has been found to, reduce the appearance of fine lines, wrinkles. It has been proven to prevent, pimples or acne, and it has been found to have some anti-cancer effects. So, so those three things I mentioned: you wash your face, you moisturize. Specifically, if you have a sunscreen in your moisturizer, that's perfect. And then at night, you also apply a retinoid to your skin. That is the standard currently. Yes. For all skin, regardless of whether it's a black skin or Caucasian skin, whatever kind of skin. That is the standard currently worldwide.
Amazing. Okay, so over to the don'ts. So what we're not supposed to do that we're currently doing, or something that you could just think of that we're not even supposed to do to our skin at all.
Yes. Many of us, I know, we love picking our faces. I'm sure at some point in time.
Yes.
So all of us have done that, We love picking our faces, you touch your face during the daytime, Sometimes if we have some pimples or some whiteheads, we tend to squeeze, those pimples to remove the whiteheads. Now, all this can cause, a lot of things. It can predispose you to having infections. You have a lot of bacteria from your fingers touching your face all the time. And then you can also cause scarring. Scarring of the skin, we know that black skin is very prone to scarring. So by frequently trying to squeeze out those pimples, you're predisposing your skin to scarring. Then, never go to bed with makeup on. And of course, as I mentioned, I think before, although, sorry, I don't think I mentioned it. You should also take care of your lips. Your lips also have skin, isn't it? So you should use your lip balm. You can use your Vaseline lip balm. You can use your chapstick. Then for your hands also, the skin over the hands is quite thin and it's quite delicate. So you should try and use, specifically hand cream to help keep your hands always moisturized. I know many of us keep, especially the females, we keep hand creams in our purses or in our handbags, during the daytime. And whenever, let's say, we do our ablution, we tend to reapply the hand lotion. That is actually really, really good. Then always make sure that if you're going to sleep, you change your pillowcases, at least once a week. Ideally, your bed sheets, your pillowcases, your blankets, you should change them once a week. Put fresh ones so that if, they're dirty, they're contaminated, that doesn't now form as a focus of infection for you, for your skin. And then, of course, try and keep your hair away from your face whenever you're going to sleep. You wrap up your hair in your ribbon, your scrunchie before you go to bed. And I think so. Those are some of the things that sometimes we do or we don't do that I think are helpful.
All right, really interesting. So I have a question here from one of our listeners. Is
Yes.
saying that um how does a person take care of their skin before or after shaving? So I believe this is a guy. He wants to know how to take care of the skin before or after shaving.
Yes. So for the guys, we have special protective creams, usually over the counter, that we can apply, before and after shaving, especially for, men that usually have like are prone to having breakouts. Men too can have sensitive skin, just like the females. So it's important that they follow this skincare routine, just like how the females follow this standard skincare routine I've mentioned before. And then, of course, before and after shaving, they have, the creams that they apply over that area to help prevent breakouts, scarring, allergic reactions, and other, skin conditions.
Okay, so he has one more question. What boils and how should it be treated?
Okay, boils. Well, boils occur usually as a result of inflammation of the skin. Boils usually, if you have boils, they're also known as pustules in medical language. Boils are actually, it's an infection usually of the hair follicle. So if you have boils, that means that there's been an infection there in that hair follicle. That leads to, that collection of, creamy whitish fluid within that boil that you see. That is the cause of a boil. Sometimes people that have, ingrowing hairs, some men that they sometimes have ingrowing hairs, and that those ingrowing hairs actually tend to irritate the surrounding skin, and that can become, inflamed and then more prone to infection. So men like this tend to have a lot of boil around their jaw whenever they shave.
Okay, yeah, but what then are they supposed to do about it? Is it still the skincare routine, still the same, using a protective shave cream or something?
Yes, well, I would advise the if he has a problem, I think it's advisable not to just decide to manage the condition on his own, but to actually consult the services of a dermatologist or a skincare expert to decide on the best way to go about it, because no two people are the same sometimes when you are managing some certain conditions. So it's advisable that he sees a skincare expert or dermatologist, to manage the condition.
Okay, really interesting. Fry it and make it into an oil. Make my own avocado oil. How is that even healthy?
Okay, from you mean like extracting oils from
Yes, just making
natural substances?
our natural products by ourselves, feeling like this is the better version, as against the ones that we buy in maybe the supermarkets or something.
Oh, okay. You mean like skincare products that are like
Yes,
formulated and are being
exactly.
sold maybe online and the rest?
Exactly. Maybe not even online, maybe just by myself. Because I
Yeah.
usually see a number of people share recipes for,
Mm,
soap, make your own soap by yourself, or make your
mm,
own cream. Exactly.
mm. Well, as we know, as medical practitioners, we always advocate that whoever is going to formulate a product for the skin should have the necessary knowledge should have the necessary knowledge. So by just anyone coming out to say, "Oh, fine, I'm able to produce soap. I'm able to produce this cream. I'm able to produce this oil." There should be some form of formal training. As you know, abroad, they don't just formulate products like that and use them like that, and then sell them like that, on the market or in the shops. They have to be standardized. There has to be a standard way in which you're mixing those products, where you're producing those products, the composition of the products, the safety, the efficacy, whether or not it has, it could cause some form of allergic reaction, and, so many other things. So, that is why whenever you're going to buy a product, it should be something that is standard, that is standardized, according to the Food and Drug Administration of that particular country. If not, then, well, all of us can produce products and then sell and then say that, oh, we can produce soaps, we have the necessary knowledge just because let's say we go online or we share recipes with people. Things should always be standardized. Products should always be standardized by the Food and Drug Administration, the health authority of that particular, country. I think that is the best advice one can give to anyone.
Okay, so interesting. Rather than just sitting back in our chains and trying to extract our own oils or try to make our own soap, it's better that we follow the tested and trusted products, basically, right? It's really interesting.
Yeah, it's the best,
Okay,
really,
cool.
because those are standardized. And they have standardized ways of producing them, and they're regulated, so those are actually safer for use.
And they've also been tested.
And you wouldn't be able to vouch for them. So yes, they may work, but I mean, they may not work for other people, or they may cause those reactions, as I mentioned before, in other people.
Exactly. The problem I even have with such is that we might not even know the accurate measurement. That's what I feel like when I see such recipes. There's no measurement. There's no limits. You just say, okay, add carrot oil. How much carrot oil should I add? Exactly. That's the issue I have with such kind of natural remedies that we make at home. So thank you so much, Dr. Hadida, for shedding light on that. So now I want to how, in terms of skin diseases or skin cancer or something, what are the things that we do? What are the, will I say, risk factors? How do we put ourselves at risk of is it acquiring, of getting skin cancer or skin diseases, skin infections? How do we put ourselves at such risk?
As I mentioned, I think at the beginning of the program, all those things that we do that I mentioned that are actually helpful in protecting us against, making sure that you apply a sunscreen of at least sun protection factor of 30 or at least 50, when you're going out, reapplying that sunscreen at least every 1 to 2 hours. That usually depends on the manufacturer's instructions anyway, but we should always make sure that we do that. Some of us have, family histories of certain cancers, sometimes even skin cancers. So we should always, go for screening tests, especially if we have, let's say, moles, we have certain birthmarks on our skin that are changing. Maybe they're growing, they're increasing in size daily, or they're becoming crusty, or they're scaling, they're becoming like open wounds. We should consult our doctor to find out whether or not it's becoming a cancerous condition. As I mentioned before, in the skincare routine, in the standard skincare routine now, it's advisable that you use retinoids at night when you're going to sleep, after you wash your face. That has been proven to have some form of anti-cancer effects with minimal, side effects. So that is also advocated. Try and avoid staying in areas where they're heavily polluted, where there's smoke, dirty environments, where you're inhaling, or you're inhaling unhealthy air. That is all bad for your skin. Make sure that if you apply your makeup, or the grimy, you use a gentle face wash or a gentle cleanser to wash your face. I think those are some of the things that we should take care of. Try and avoid using our hands using our hands to pick up, harmful objects to avoid, injuring the skin. And I think a host of other things, but I think these are some of the, common things that we can do in our environment to help protect our skin from cancers and infections.
Okay, great. Thank you. Really amazing. So basically, we should take notes very much of using moisturizers that have sunscreen. You said up to 30 or 50, and then we should possible to reapply about 1 to 2 hours every day. Okay. I got that.
Depending on the manufacturer's instructions, yes.
Okay, depending on the manufacturer's instructions. I've got that, and I'm sure many of our listeners have also taken note. We have a number of our guests, of our listeners in the house. So please, if you have any questions, just unmute yourselves and ask your questions. Please make sure that you're asking your questions from a noiseless place so that it doesn't interfere with our conversation. Thank you. So yes, Dr. Hadiza, I have one more. Okay, I think Arthur has a question.
Yes, Assalamualaikum. So, Dr. Hadiza, you mentioned something about sunscreen, applying it 1 to 2 hours depending on the manufacturer's guide. What if for somebody that doesn't go out, like you literally stay at home all day, is it necessary to also apply sunscreen? That's my first question. Then, Zainab was talking about something about, waxing for men. And I was like, okay, from a female perspective also, is there like a care somebody can do pre-waxing and waxing to avoid, all these and bumps and everything for females also?
Okay, waxing the skin to prevent what?
Ingrowth of bumps for females, like waxing.
Okay. All right. Yes. So for the sunscreen, it's much more important when you're going to go out. But we do know that, of course, you're still at risk of sun damage even when you're inside your house. Just because one is inside the house doesn't mean that the sun is not the sun rays are not penetrating through the windows. So you're still exposed to the sun. It's just that when you go out, you're more exposed to it. So it's more advocated when you're going to go out. Besides, if you have your moisturizer that has your sunscreen, it's something that you use every day. So I don't expect a person to have, let's say, a moisturizer that doesn't have sunscreen and then one that does have sunscreen. You just have probably just one, that you use every day. So whether or not you're going to go out, you should use it, because yes, the sun rays still penetrate through the walls, through the windows, into your houses. Then for the waxing, well, some people are actually more prone to developing ingrowing hairs, more than others. But we should note that waxing, is something that should be done by the experts. It shouldn't be done, frequently, because if you're prone to developing skin conditions, the more that you apply, pressure, some form of trauma over your skin, the more you are actually scarring the skin or making it prone to develop certain skin, conditions. So I think that should be handled in the hands of experts, depending on the type of skin that you have.
Okay, amazing. I just got to know that the sun could actually even penetrate our walls, through our windows, into our houses. So even when you're at home, you're still advised to apply your sunscreen. Wow, I thought, when you're at home, there's no sun, so just be happy and free. Right.
No, you still have the ultraviolet B rays that are still coming in through those, so you can't avoid them really. Totally.
Amazing. Okay, so Dr. Hadiza, I'm sure you know this one because it's something that's almost everywhere. They usually say that if you eat too much groundnuts, that your face would break out. Please, how true is that? Because I never believed it.
Yes, actually, some people do have breakouts when they eat certain foods, but of course, it's peculiar to certain people. But you should try and take note of the kinds of foods that make you develop breakouts. Some people are actually allergic to those groundnuts. That's probably why they break out. Not necessarily because, groundnuts cause, or groundnuts or peanuts cause breakouts in all people. Do you understand? So if you notice that, yes, you tend to develop certain breakouts if you eat certain foods, then you should avoid those kinds of foods.
Oh, groundnut has an inherent quality that makes it or makes people break out. It's just that that person may be allergic to groundnut or may be
Yes.
allergic to another food. Amazing.
Yes.
So somebody has a question. It's about vitiligo. She says, what causes vitiligo and are there cures or is there a cure for it?
Yes, well, vitiligo is actually a medical condition. It's a medical condition of the skin, and it is something that develops gradually over time. It is actually one of those difficult conditions that can't be completely eradicated, should I say? It requires a number of different, a number of treatments. It ranges from the highest to the lowest. So anybody that has vitiligo should actually see a dermatologist or skin specialist, in order for him to get the necessary advice on how to manage that particular condition, because it's something that can be quite distressing. It can be quite tasking on the mind, So I think physicians are in a better position, specifically dermatologists.
Okay, but there are no specific things that would say causes it, right?
No, it's actually a genetic condition. It's actually a
Genetical.
genetic condition. Yes, it's a genetic condition of the skin. So that is why, sometimes when you have, lots of times when you have genetic conditions, right, that you're born with, because you had some form of, mutation or alteration in your genes, in your chromosomes, they're usually very difficult to manage sometimes. And so that is why, you have so many different ways of treating them. And that is why I advise that, that sort of person should see a dermatologist in order to explore all the various avenues in which to manage this skin condition. It actually causes, patchy hyperpigmentation of the skin. So you find out that people with vitiligo have, lighter skin, like patches or spots of lighter skin around, the body. Yeah, you find it all over the body, commonly around the eyes, commonly around the nose, the mouth, and that can be quite distressing because it's something that is so obvious, it's so glaring. Whenever you see a person with vitiligo, they're so, they just
stand out.
Yeah, they stand out. They stand out.
Yeah, and it's usually around the face. The ones I've seen, it's usually on the person's face. So basically, it's like it's a genetic condition and should be managed medically. Amazing.
Yeah.
Okay, so another person has another question. This is about stretch marks. So, Dr. Hadiza, please, do you know what causes stretch marks on the body?
So stretch marks, there are so many different causes of stretch marks. I think some of the common causes of stretch marks are, you see stretch marks in pregnancy. You see stretch marks when, in puberty, when, you are just evolving to become an adolescent, to become an adult, you're an adolescent. You see stretch marks when you've had like a recent loss of weight, So generally for stretch marks, you actually tend to have, the skin has been stretched because of those conditions that I mentioned before in pregnancy, because of the, the increasing growth of the fetus. You have, increase in, it's like the skin expands. And so likewise in adolescents, because of their rapid growth, they tend to have stretch marks. For those that are losing weight, that probably would put on some weight and are losing it because the skin had been stretched, when they now start losing the weight, you now see it much more, significantly. So for stretch marks too, there are a number of ways, to manage stretch marks. A lot of people use over-the-counter creams, lotions. Stretch marks can be quite difficult to manage, especially if they're advanced, if they're, very extensive. Sometimes, in fact, in many conditions, if they are very excessive, same thing, you need to see your dermatologist to advise on the best way to manage those stretch marks. sometimes they can actually disappear, especially if you use some over-the-counter creams and lotions, sometimes emollients. They do disappear sometimes, but sometimes if they're actually quite extensive and they're advanced, you may need to seek the services of a dermatologist to advise on the next best method to manage them.
Okay, great. So, stretch marks basically are like when the skin had been stretched initially and then it leaves a mark on the body. Because I'm usually so surprised at why, because the narrative is that only fat people get stretch marks, right? That's that's usually what we hear. And then we see very slim and slender people having stretch marks, and then it causes a confusion like, why is this slim person having a stretch mark? So,
yeah, so those are just some of the common causes where we have stretch marks. It's generally because of that expansion of the skin. And yes, some people are actually more prone to it than others, but generally those are the common causes.
Okay, great. Thank you. So somebody is asking, is there a difference between organic whitening, lightening, exfoliation, and bleaching? Organic whitening, lightening, exfoliation, and bleaching.
Well, you see, these days, especially in the manufacturing, sector, in the world we live in now, a lot of companies, a lot of industries, use different names for their skin bleaching agents. So you find out that if a product says it's a skin whitening or a skin toning or a skin bleaching agent, it usually means the same thing. It contains a product or products that will lighten the skin. So for people who don't want to just outrightly say that it's a bleaching agent, they refer to the product as a skin toning agent or a skin whitening agent. But basically, it is still a skin bleaching agent because it contains a chemical or a combination of compounds or combination of chemicals that can cause bleaching of the skin. For the exfoliation is a different thing altogether. Exfoliation, as I mentioned before, is using certain agents, certain formulations that help to really deeply cleanse the skin, and it's advised that you use the healthy, fresh, and glowing skin. So those are the differences.
Okay, great. So there's usually no difference when we see whitening, lightening, or toning or bleaching. Maybe slight or usually no difference, but exfoliation.
Really no difference. It's just the terminology. It's just the terminology that sometimes there's this stigma attached to saying it's a cream or lotion is a skin bleaching agent. So the companies would rather refer to it as a skin toning agent or a skin whitening agent. Just to make it a bit less.
A bit more acceptable by the audience.
A bit more acceptable, exactly. Exactly. But basically, a lot of those products are actually skin bleaching agents. And skin bleaching agents, that's a whole different topic on its own. And of course, we all know that skin bleaching agents are only to be used in the hands of skin experts, dermatologists for certain conditions, and they're regulated. But the way they're used these days is that anybody can just go over the counter, buy a skin bleaching agent because they want to become fair, and they use it in the wrong way, and we've all seen the damage that it causes to the skin.
Wow, amazing. Also, this has been really insightful and eye-opening. Thank you so much, Dr. Hadiza. We'll go on a very short break now, and then when we come back, we're going to wrap up the conversation. And if you're just joining us, we were talking about how you should treat your skin. We've mentioned a number of do's and don'ts on why or how you should take care of your skin, what you should do, and why you should not do what you're not supposed to do. And we have Dr. Hadiza with us doing that for us, and she's really done justice to the topic because it's been really exciting and enlightening, right? So I realized that there was a break in transmission during the course of our conversation. Apologies for that, but remember that you can listen to previous episodes, that means you can listen to this episode on EN Radio Podcast. You just have to go to www.enarrate.com/EN Radio, or you can use any of your podcasting apps to find us. So, yes, finally, Dr. Hadiza, somebody was asking about face wash. I remember you mentioned something about using a mild face wash rather than using a sponge or something. So somebody was asking if face wash is for everybody or if there are particular skin types that are supposed to use face wash.
No, face wash, there are various kinds of face washes. There are some face washes that are actually good for, acne or pimple prone, or should I say, blemish prone skin. And some of those face washes actually have other compounds added to them. For example, you have some face washes that have benzoyl peroxide or even salicylic acid. Now, those ones are actually good for people that have breakouts, commonly have breakouts on their faces. Other facial washes, don't have, some of those compounds. Sometimes you can actually use, a very mild soap. For example, I'm sure you've come across this Dove soap in the market. It's actually mild. It's good for generally all skin types. So you can actually use a soap, a mild soap that is good for the facial skin, or you could use a face wash. Depending, there's so many on the market, but you just have to find out the one that is good for your skin. But generally, standard companies that are known to, produce these compounds, that have been known to be producing some of these formulations over the years and have been found to be effective, are actually better than just buying any over-the-counter facial wash or facial bar. So that's generally what we would recommend.
Okay, really interesting. So anybody could use a face wash, but then you have to be particular about what it's made of, right? So you have to know that it's been proven and it's mild enough for your skin, basically.
Yes.
Okay, so Dr. Hadiza, do you have any, final comments, final words that you probably want to leave with our listeners about their skin, what they should? I know we already talked about what they should do, what they shouldn't, but any final comments that you have for them before we go?
Yes, I noticed there were so many questions on, how to protect your skin. Then, of course, questions on stretch marks. I think there were questions on, pimples, acne, breakouts. So I actually covered some of those topics on my YouTube channel. I actually have a YouTube channel where I discuss, certain, conditions, skin or otherwise, whatever I find people, have questions about. I usually, talk about things that I think are usually very important for the general populace to learn about: emergency medicine, burn injuries, skin conditions, skin diseases, a number of other, topics. So if you'd like to know more, you could just go to the YouTube channel. It's called the Medical Information Channel, and it's free. So it's a free resource. And then if you have any other topics that you'd like me to cover, you could always, drop a comment below any of the videos. And if there are enough people that are, want to know more about that topic, I could actually cover it in a subsequent video. Thank you.
Okay, great. Yeah, so guys, don't forget to go on YouTube and tune in or subscribe to the Medical Information Channel if you want to know more about your skin. And you should even want to know more about your skin, because that's like the one and only skin that you have. There's no alternative to your body, right? Yeah. So thank you very much, Dr. Hadiza. This has been very interesting. I'll just go over some of the things that we talked about today, starting from some of the myths that I really wanted to clear. About applying toothpaste on your pimples. So that's not really advisable. You should use products that have been tested and proven to be effective for the skin, not just because toothpaste is toothpaste, not face paste. So yeah, and then I also asked about applying menstrual blood to the skin, because I've seen that somewhere. And no, she said no. It's a no, because it's something that's out of the body and then it's prone to bacteria. So it's like you're just inviting more infections for your body, right? And then yeah, we talked about some of the do's. She said something about applying retinoid. That's like a new. It's Dr. Hadiza, did you say that's a new skincare method or technique or something?
It's not actually a new, it's not actually new in the skincare routine. It's just that so many people don't know about it. And so I
Okay.
just felt it was good to just put it out there so that people are aware that, there is a standard way of your, of skincare routine now, and that everybody should know about. And I think because we are, being blacks, having black skin, we need to be aware of how to take care of it effectively. A lot of the Caucasians are already aware of this, but I think many of us, especially in Africa, Nigeria, West Africa, might not know about this standard method of, of care for the face. So I just felt it was important for us to know that.
Okay, great. So apply retinoid, eat a balanced diet, vegetables, fruits, exercise, and plenty of water. And then some of you don't go to bed with makeup, breathe in clean air, and then take care of your lips because your lips also have skin. Use a hand cream, change your pillowcases, and then keep your hair away from your face. Yeah, that's about what I was able to write down because it was more than that. This has been really interesting and enlightening. Thank you so much, Dr. Hadiza. Thank you so much to the guests in the house who also asked the question and the ones not here but also asked the question. Thank you also to our listeners. We will not be here without you. Thank you for your support. And so until we meet again next week, I say Assalamu alaikum wa rahmatullahi wa barakatuh.
This is EN Radio. Nigeria's first Muslim radio.